So people don't often realise how much training goes into aesthetic skin treatments. So I started my journey about 23 years ago in the beauty industry, and then did all my levels at college and also private clinics, so level 2, 3 and 4. Then I've spent the last 13 years in clinical backgrounds, again studying and training in various systems, like for example Linton lasers, Cutera, skin pen, luminous, cryotherapy, Sterex diathermy, to name a few, Abaji skincare, image skincare, SkinCeuticals. So it's basically ongoing training, really. It's training all the time so that I'm making sure I'm up to date with latest innovations and latest products and latest treatments, tweaks as well. So I get optimum results for clients. Having a good relationship with your patient is very important, making sure you're aware of medical background, any conditions, any contraindications to treatments, so that treatments are correct for that client. So care is very important, trust, and then you also build a nice relationship with that patient. They will come back and then they know that you're there for them on their journey. So most patients will ask for these three main treatments. So I offer diathermy. I use a Sterex machine for benign lesions and dilated capillaries. That's kind of like thread veins, skin tags. I also do cryotherapy, which uses nitrous oxide to freeze benign lesions, and plasma skin tightening to pull out lines and wrinkles, increase collagen and plumpness. So that's fantastic around the eye area, for eyelids, crow's feet, eye bags, smoker's lines, neck, décolleté, even tummy treatment. So things like crepey skin, lines and wrinkles, improve elasticity, tone and texture of the skin. This together with the Abaji medical skincare for fantastic results. So medical grade skincare, really nice strong skincare to improve plumping, reduce inflammation, help with acne as well. So everything can be delivered measurably and then must be continued use for at least 6 weeks for optimum results. So diathermy is really underrated treatment. So fabulous treatment. It offers a variety of skin concerns. So for example, like skin tags can be removed and cauterized there and then, so they're gone. Dilated capillaries or thread veins, especially facial area, can be blanched and removed. Things like milia, so the little pearly balls underneath the skin, sometimes kind of can be found along here. The little needle is inserted and they will just disappear. Be a little bit red for a couple of days, but very minimal downtime, low risk and fantastic results. And it will also mean that patients' uplifted mood as well, especially say, for example, you have like a big wart on the face, so they can be removed instantly, usually one treatment and 2 at the most, and completely gone. No scar tissue even, so low downtime. So that sounds really dramatic and maybe a little bit frightening, but it's not. It's such a simple treatment. So I use a freezing method to freeze a benign lesion. So say, for example, oral wart or verruca, you're talking 30 seconds and it's treated. Sometimes a second treatment is required, especially maybe if it's old and established and it's gone that little bit deeper into the skin barrier. It just feels like a cold freeze that's hitting the skin. We can pre-numb it as well if that's needed. And then results, you're looking at sort of 3 weeks, all gone. So easy, minimal downtime, hardly feel any pain at all. So this is relatively new on the market, probably the last sort of 5 or so years. Really innovative treatment for skin tightening with precision as well. Fantastic for eye area, so eyelids, crow's feet, under eyes, eye bags, smoker's line. So it will skin tighten, it will encourage collagen, so kind of like plumping if you think of it, underneath the skin. So it will pull out physically lines and wrinkles and help to minimise. So any areas really, crepey tummies as well. So it's really diverse. Full consultation required beforehand just to check suitability. Minimal downtime. So you're talking at the most kind of 10 days. You have a little bit of redness and swelling and some little brown crust where the plasma arc has hit the skin. So these are a few things that patients will notice after treatment. So improvements will go on week after week. So kind of optimum results 6 months, but all the way through to 12 months after treatments. So skin will be firmer, improved tone and texture, smoother, coloration as well. So you'll find your skin will be nice and pinky. You almost get that youthful glow back. Texture as well. Lines will be minimized, lines and wrinkles will be minimized, and such a massive confidence boost as well for patients. So, you know, their skin's looking better, they're feeling better, they're much more confident in themselves. So patients will notice a massive improvement within their skin when they pair it with some decent medical skincare. So much stronger than over-the-counter skincare. So you're looking at optimum results. Usage should be at least sort of 6 weeks, and then you'll see increased firmness, improved tone and texture of the skin. So lovely smooth skin. It's fantastic for anti-aging. So increasing collagen under the skin, reducing inflammation. So if you notice a little bit of redness, maybe on the cheeks or the nose or the chin area, we can help to reduce that by simple sort of skincare, correct cleanser, moisturizers, and good SPF is paramount. Overall improving skin health gives you a good foundation as well. Your makeup too, so your makeup will glide on so much better. Improve mental health, so a great, fantastic treatment to help improve mental health as well and feel more confident in yourself. So there's not just one treatment that fits all. There's not one size that fits all. Everyone is different with their skin. So making sure a thorough consultation is carried out. So looking at medical conditions, any prescriptive medicine that's being taken, everything needs to be taken into account. Lifestyle as well. So do you go to the gym? Do you exercise? How is your food and your nutrition? How is your mental health? Because it all affects our skin. Stress is such a big contender really with our skin. So overall approach, looking at that, looking at your goals, what do you want to achieve and how can we manage that? So it takes time. It's not going to happen in one day or 1 week. You're looking at 6 weeks plus for optimum results and then improvements along the way. And then tweaking skincare. So you may notice your skin feels different in the summer as to the winter. So then it's changing products, looking at how we can achieve more moisture, more hydration in the skin, but such a massive positive outcome for using good quality skincare and helping with our overall appearance and feeling much more confident in ourselves. This is where medical aesthetics really comes into its forefront. So making sure that I have a full consultation. So there's full disclosure on medical conditions and any medication, informed consent. So everything is carried forward with the client. So you're fully aware of what to expect, any downtime, any aftercare. We want optimum results for you. Any contraindications, so anything that goes against the treatment, I'm fully checked and safe that I can carry out that treatment. Also keeping patients advised as to what will happen. So that's called counteraction. So anything that happens after treatment, whether it's a little bit of redness, whether it's a little bit of peeling on the face or dryness, sometimes we have to go through this process to get optimum results at the end. But keeping you informed is the best practice for us. So this is the biggest myth that we hear. It's not about surgical procedures, it's about enhancing your natural features. So it's using non-surgical procedures, good medical grade skincare to enhance what we have, to improve what we have, to give our skin nice plumpness, firmness, overall improve our mental health. It's not about drastic changes. As I said, surgical, it's just enhancing naturally our best features and making us feel so much better in ourselves. So this is the first question most patients will ask, and obviously it will depend on what treatment that is performed on their skin. So good advice, background, how to treat the skin, looking after it are all very important. So information, aftercare are very important within the consultation so that I have optimum outcomes for you, best improvements for your skin. So for me, it's not just about the patient's skin, it's also about building your confidence and making you feeling better within yourself. It's building trust with the patient as well. So we can see improvements from start to finish. And then it's just continually monitoring your skin and in doing it in an ethical and honest way is the way that I wish to go forward with you. So if you're sitting on the fence and you're really unsure as to where to go and who to choose, ask the questions, do your research, make sure you have a suitably qualified practitioner. Everything that is your concern, ask and then expect like good constructive feedback. And also expectations need to be met within a time frame. So ask how long it's going to take for you to reach from where you are to your end goal. So there should be realistic expectations and a constructive treatment plan as well so that we can reach your end goal.